Hello, citizens of Internet. I am Dr. Ajit Virkud, Professor of Obstetrics and Gynecology and ex-Head of Department of Obstetrics and Gynecology from Mumbai, India. In this module, I will talk about cervical cap, which is another percoital contraceptive device that is not very widely used. According to me, the main advantage of this device over vaginal diaphragm is that it is ideal for younger nulliparous women with tight vagina and a normal size and normal shaped cervix, and not ideal for multiparous women who have a larger parous cervix. The cervical cap, commercial name FemCap, is a reusable cup that is described as looking like a sailor's hat. It is a dome-shaped device made of silicone. It has a loop or strap at the bottom that helps in its removal when required. Its mechanism of action is as follows. Cervical cap fits snugly over the cervix and thereby prevents active sperms from entering the cervical canal, thereby preventing pregnancy. When a spermicidal agent like nonoxynol 9 is used along with the cervical cap, that also helps in killing the sperms instantly and prevent pregnancy. It stays in place by suction. The cervical cap should not be used by women who have an abnormal shaped cervix, a history of pelvic inflammatory disease, abnormal pap smears, severe cervicitis, allergy to spermicide or silicone, women who are at high risk or have HIV or AIDS, women who are at high risk of pregnancy, for example, women under 30 years of age, women who have sex more than 3 times a week. The cervical cap is available in 3 sizes. Selecting the correct size is important. The cervical cap size is based on the patient's obstetric history. Small size cap, which is 22 millimeters in size, is for women who have never been pregnant, that is nulliparous women. Medium size, that is 26 millimeter size device, is for women who have had an abortion or a cesarean delivery. And the large 30 millimeter size is for women who have had 1 or 2 full-term vaginal deliveries. Insertion technique of the cervical cap is as follows. Prior to intercourse, approximately 1/4 tablespoon of nonoxynol 9 spermicide is placed in the cap and an additional 1/4 tablespoon is placed along the rim. The cap is then turned over and an additional 1/4 tablespoon of spermicide is placed in the groove between the dome and the brim. The insertion of the cap is similar to the insertion of vaginal diaphragm. Find a comfortable position, either standing with one leg elevated or lying on one's back or sitting, as the cervical cap is inserted with the dome strap side down and with the long brim edge entering the vagina first, so that the wide aspect of the cap brim is positioned in the posterior vaginal fornix and the narrow aspect goes anteriorly. Make sure the cap covers your cervix by feeling around with your fingers. If you can feel your cervix, move the cap until you can't anymore. You may feel a little uncomfortable when you fit the cap for the first time, but in a few minutes you will feel alright. An important point to remember is that only those women who are familiar with their genital tract anatomy and those who can feel the cervix with their finger are able to fit the cervical cap properly. Others may require the help of a doctor. It is important for the woman to remember to put the cap up to 6 hours before she has sexual intercourse. This means that if she and her partner get into the mood and want to have spontaneous, unplanned sex, cervical cap is not the contraceptive answer. Another important precaution is that she must leave the cervical cap in for at least 6 hours after having sexual intercourse. This gives the spermicide time to work if any semen got inside the vagina. However, she should never leave the cap inside the vagina for longer than 2 days. If she wants to have sex multiple times, she can remove the cap and apply a new layer of spermicide before inserting it again to stay protected. The removal procedure is as follows. A squatting position will give you best access to the cup. Insert one finger into the vagina and then press hard against the squishy center of the cup to break the suction. Insert the finger into the small strap at the bottom of the cup. Gently pull the cup out of the vagina. The following precautions must be followed when using the cervical cap. The cervical cap should not be used during a menstrual period. Refitting may be needed after having a baby or after weight loss or weight gain. The cervical cap is less effective in women who have given birth. You should wait 6 weeks after giving birth to use the cervical cup until the uterus and cervix returns to normal size. Care and maintenance of the cervical cap is similar to that of vaginal diaphragm. After each use, the cap must be washed with mild soap and water, rinsed and air dried, and then stored in the case provided. Don't put baby powder or oil-based lubricants such as mineral oil, petroleum jelly, or baby oil on the cap. The cervical cap can last up to 2 years. Failure rates of cervical cap are as follows. It is 13 to 16% for nulliparous women and 23 to 32% for multiparous women. Although perfect use rates are lower because of better effectiveness, they are harder to achieve in practice. It is important to inform users about the overall relative lower effectiveness of the product and the increased failure rates observed in parous women due to cervical and vaginal alterations following childbirth. The main side effects of cervical cap are possible vaginal irritation or urinary tract infection. Toxic shock syndrome has not been reported in cervical cap cases, although the risk is biologically plausible. The advantages of cervical cap are reusable and relatively inexpensive, small and easy to carry, requires less spermicide than a vaginal diaphragm, rarely hinders the sexual experience, may be used for repeated intercourse within a 48-hour period, allows prompt return to fertility, can be used while breastfeeding beginning 6 weeks after delivery. It does not affect milk supply if the woman is breastfeeding. It can be inserted hours before sex and remain in place for up to 48 hours. It doesn't require partner's cooperation. It has few side effects, if any. It has no effect on women's natural hormones. Disadvantages of cervical cap are: the cervical cap does not protect against sexually transmitted infections including HIV. The woman using it has to be knowledgeable about her internal genital tract anatomy and should be able to insert and fit it over her cervix. It requires consistent use for each sexual encounter. Spermicide may be messy and has been linked with mucosal irritation and increased susceptibility to sexually transmitted infections. A prescription is required. Rarely, it may get stuck in the cervix, requiring it to be removed by an healthcare provider. If you like this OBGYN content and want to learn more about this topic, please join my affiliate membership program. The details are as follows. This is an exclusive opportunity to deepen your learning experience with my channel membership program. By joining, you will gain access to high quality, in-depth content that I have created specially for you. There are 3 exciting membership levels. First, the basic level. This level provides access to select videos and shorts that will help strengthen your foundational knowledge. It's perfect for those who want a taste of what we offer without committing too much. Second, the priority level. At this level, you will have access to all our theoretical topics. This is ideal for those who want to ensure a strong theoretical understanding and wish to stay updated with the latest advances in obstetrics and gynecology. And finally, the premium level. This is the ultimate package. You will receive everything from the basic and priority level, plus exclusive access to both theoretical and practical topics. This includes my masterclasses on various practical topics and the privilege to watch orations delivered by me in India and abroad. It's a comprehensive learning experience designed to equip you with the knowledge and skills to excel in your career. By joining this membership program, not only will you get access to all this incredible content, but you will also be supporting the channel, allowing me to continue bringing to you the best educational material possible. So, what are you waiting for? Click the join button below and choose the membership level that best suits your learning needs. Thank you so much for your continued support. Together, let's embark on this educational journey, and I will see you on the inside. If you want to know more about this topic or any other topic in obstetrics and gynecology, please refer to my books Modern Gynecology, Modern Obstetrics, and Practical Obstetrics and Gynecology, and other books. For purchase inquiries, contact me on this WhatsApp number. I have also published 2 question answer books which are particularly useful for exam going students. These are Clinical Cases in Obstetrics, 1000 plus questions and answers, and Clinical Cases in Gynecology, 1000 plus questions and answers. These are also available on Amazon.in. You can also follow me on other social media platforms like Facebook and Instagram. The links are given here. If you enjoyed this video, hit the like button, share it with your friends, and also subscribe to my channel for more videos like this. Thank you for watching.